Good afternoon, everybody. My name is Supriya Shetty, and I will be presenting the seminar on, to start with your healthy mouth. I have to stay next to this mic, so I'll remind myself to move here. We all heard about different foods that we can eat, all the healthy foods that we can eat. But we need a healthy mouth to digest, chew that food. So that's where I am going to be concentrating on, is about healthy mouth. Just something about myself. These are my 3 little blessings that I have, ranging from 12 to 2. And I did graduate from dental school in India, went to dental school in New York. So I did 8 years of dental school altogether. Then now I practice in Pewaukee, down very close by. My grandfather, when I was studying dental school in India, mentioned to me, he asked me, why do you need 5 years to learn about 32 teeth? I said, I really don't know, but it taught us a lot. Again, I had to do 4 years again to learn about 32 teeth. But I'm still learning, especially being a holistic dentist. It's a different channel. Every day I learn different things from my patient. You will be amazed how much my patients teach me, and they intrigue me to learn more. This is a picture of me and Dr. Mann. Dr. Mann we both practice the same kind of dentistry. We're both accredited from IOMT. It is an International Academy of Oral Medicine and Toxicology. It is an organization which credits us. We go through a certain certification to be trained. We are trained members of Huggins Alliance. Huggins is the one who really started removal of amalgam mercury fillings. We advance mercury removal protocols, and we also train in ozone. Dr. Waters, who's here with us, he does a lot of ozone too. We've been trained, but we concentrate doing ozone in the mouth. This is a saying which my dad raised me with. Actually, the second part of the sentence, which was very important for him, was, your face is the index of your mind. We can tell, like right now, I'm really nervous. But so the next is the index. The mouth is the index of your gut. What we eat reflects. What we eat shows in our mouth. For example, this is a picture of a tongue. You see it's burning. This person probably has burning tongue. It's called as median rhomboid glossitis or migrating glossitis. It can be caused due to vitamin B complex deficiency, stress, and is also the unknown. The second picture to your left is a person who has dry mouth. Could be a bad brusher, but the dentist could go ahead and tell him, you're not brushing your teeth really good. But it could be from radiation that could have caused his mouth dry. It could have had from all the medications that you do, can cause dry mouth too. And the lower left picture is most of us get is a canker sore, which could be from acidic diet. Again, stress is related to it. Now, this is a statement from a doctor called Dr. Walls. Dr. Walls was in 1950, a German physician. Sorry, let me go back. Dr. Walls was a German physician who did say that if 80% of our illnesses are related to your mouth. So if you have a healthy mouth, you can say you have good health. If you don't, there could be a reason why you're having unhealthy mouth. Now, what does a healthy mouth look like? A healthy mouth is a one that doesn't have any disease, any dental disease like gum disease or tooth disease, no toxic burden, or any malocclusion. Now, each slide, I'll go over each of them. Now, dental diseases, you always go to your dentist, they talk about cavities and gum disease. About 75 to 80% of people, we can talk about this room, 75 or 80% of these people in this room will have some form of gum disease. The gum disease can range from as simple as when you floss, your gums bleed, to a certain where your teeth is moving. So that's gum disease too. Now, why is one causing the other? That's when you get to know more about. The second part of the tooth disease that we have is cavities, caries, any hole in your tooth. A tooth decay is the second most common disease that we have, in addition, it's second to a heart disease. Especially with the food that we were talking about all day today, healthy food. We always assume that healthy food is not going to cause you any cavity. You eat an apple, you drink milk, raw milk, anything that you eat finally stays in your mouth and it breaks down to an acid. Just imagine an acid, when it stays in your mouth, what is it going to do? It's going to make a hole in your tooth, so that's where the cavity comes in. I have these questions a lot asked by my patients. I eat healthy food, why am I getting cavities? It's how long it lasts in your mouth. I always recommend my patients, if you're eating anything healthy or eating anything other than water can cause cavity, give it about 30 minutes before you brush or rinse your mouth. Because anything that stays there after 30 minutes is when your pH in your mouth starts to become acidic, which is the environment where we get cavities and also gum disease. So far, everybody is going okay. I know I have an accent, so you're not used to this accent all day. So if you guys have a hard part, let me know, okay? Then this part is, we talked about the disease and we talked about toxic burden. Now, toxic burdens can come from different things. One is metal. Metal like crowns, braces. Second is amalgam. Amalgam is the filling that is used in your mouth. The root canals, fluoride, and the food. A lot of foods can cause us toxic burden, and just like the previous seminar that we heard about. Metals, the one that is used as mercury, amalgam, silver filling. These are the different names that you use to restore your filling. When you have a cavity in your mouth, it's replaced with some material. It could be amalgam that you see here. It could be a white filling. It could be a ceramic. And a crown, too, which is made of metal. Amalgam was an effective filling for 100 years, over 100 years, yes. It still is an effective filling. Yes, it is used because it's a very cheap material to replace a filling. And it's also to use an amalgam filling, even my daughter who's 12 years can do it. I can have to just numb the patient. It's so easy because you really don't need to have a controlled environment. It is very simple. But is it safe for us? From the practice that I've been doing, I have patients who come to me every day and come in with every concern. They come and say, I'm having this issue. Do you think it's an issue? They want to get this burden out of their mouth because if they're going through any healing process, any detox or chelation, they want this taken out. So we have doctors who have their patients come in to take it out. And that's where the Huggins protocol that we were trained for comes into play. It's important that this amalgam that is taken out safe and sound. When I mean safe, it's very important that I just don't drill into powder. It's not like working on the concrete that you have all these powders released. You can inhale the fumes of mercury, which is not good for the patient and also not good for me because I am working on it too. So it's very important. Then we even make sure our room have the certain ionic generators, charcoal filters are very, very important. And when we cut it out, we make sure we cut it out safely with a lot of water. So the amalgam, we take it out safely. The next slide is a little point for us to ponder on. When the FDA considers mercury to be toxic before it goes to your mouth. The EPA considers mercury to be toxic after it leaves your mouth. But the ADA considers mercury to be safe in your mouth. So the only safe place of mercury is in your mouth. So take care of it. But it is something that after you read this, you start to think about it. What is it? Is it true? Or like if you go to your dentist, if you ask him Monday morning when you have an appointment, if you do, is it safe? And they're going to say, yes, I've been using it for a long time. I've graduated from dental school twice, and we did use amalgams a lot. And always I joke about it because we inhaled so much mercury during school. We are crazy so much because we did not care about where the mercury was. Because the time when I did dental school in India, we actually used mercury droplets, mixed this silver filling and the other alloy, mixed it together, squeezed it in a little cloth, take out the excess mercury. So we did it, and we never realized this mercury has been If I spilled it, I had to call a department which would come and clean it up, but I could use it without any protection. So it was important to look into now, but now I practice it much different. I wish I knew what I know now. But there was a dentist who was doing dental school in United States, and he wanted to join the IOMT, but he was refused. The professors told him not to join it because it was quackery. Yes, it is quackery for most of the stuff, and most of the things that we're doing today in this hall today could sound quackery for most of the other people who are very conventional. But is it true? It is up to us to think. Then the next part, the toxic burden that we talk about is root canal. How many in this room have root canal? Okay, 50% of you have root canals in the mouth. Just a root canal is a procedure where a part of your tooth, that's a nerve of your tooth, is removed and is replaced with different material. Now, a root canal could be toxic because it's infected. It has bacteria in it. It could be the technique, the person who's done the root canal. And also now the bacteria that caused that infection, most of you who had a root canal could have had a big swelling on the face, had a lot of pain, and then they were seen and they had to get the root canals taken. But the bacteria, is it completely killed? That is important because the bacteria, they release toxins, and that could channel to your entire systemic body. Then the biocompatibility of material that is used to replace it. Now, the next part, the energetic disturbance, I'll talk to you more about it. And the bone disturbances is because when there's a root canal, there's infection, it's taken away your bone. Every tooth in your mouth has a relation to different organ. If you visited the table that we were in, you probably had this tooth organ chart, which is actually developed by a lot of physicians that put it together. It is related to acupuncture spots. So if people are picking up in the table, picking up the root canal and connecting, do I have this issue? We have a lot of patients that will walk into the office with a root canal on a certain tooth, like tooth number 4, and they will say, I have a cancer of the breast, or I have cancer of the colon. So it is, which came first, the chicken or the hen? That we never know. The egg or the chicken. The chicken and the hen both came together. But it is very important because you never know who did it. There was a dentist in Germany where the Germans, when they become dentists, they actually have to go through school, the medical school, to become dentists. And he actually did a study where he found the materials that were around the root canal area and the cancer areas in the other part of the body. They had the same histological feature. When I say histological, under the microscope, they almost looked identical. So it was a sample from 2 different areas, but they looked identical. So that's where when we do root canals, we really make sure that it is right for you. Is the procedure right for you? Is it compatible for you? So those are the things that we look into. Now, which came first? Did heart disease, diabetic, or rheumatoid arthritis? There are many diseases that are related to the mouth. Long time ago, they used to say the person who had gum disease would have heart disease, or would be diabetic, or could have any other systemic diseases. But now it is seen that people who have gum disease can be at risk of having these heart disease. When we as a dentist, you're not cut off from your head. The whole body, the whole head is related to the rest of the body, which is why we are connected. Every tooth is connected to the rest of the body. So any infection that you have around a tooth can actually travel down to your heart, or it can travel down to different areas. Especially like rheumatoid arthritis, it is studies that have been done when people who have bone loss because of certain bacteria predominant in the mouth, that bacteria can actually be around systemically and go around to the bone in the rest of the body, and that's why you can get arthritis too. And there's actually a book written by Mouth Matters, is a hygienist who's written it, and she has a lot of studies in it which talks about different diseases. Then the last part of healthy mouth is malocclusion. Malocclusion is occlusion not off. What is occlusion? Occlusion is where your teeth meet together, the top and the bottom teeth meet together. Now, having bad occlusion is not just for aesthetics. It's like, okay, you see these pictures on the left, you probably see, okay, it is really bad. It's not aesthetically sound. But a person who has bad occlusion, appearance in the face, you can see that. It's discomfort chewing, so that affects your food, so you're not digesting your food. While you chew your food, you actually need to break it down. The first part where food breaks down is in the mouth, where it gets mixed up with your digestive enzymes, your saliva, which has some, and then it goes down to the stomach, then it goes down more. So if you don't have person on the slide B, if he probably cannot chew his food really well as somebody on the slide B. So, the slide C and B, you can make a difference. Somebody biting down and chewing is going to be hard. Speech problems. Then the last part is a person who has bad occlusion is also a mouth breather than the nose. Breathing through your mouth is not good. People do say, I sleep, I breathe through your mouth. That is not normal. You need to breathe through your nose. There's another part that, especially with malocclusion, people have is sleep disorders. It's a part where is new to dentistry right now, but we have been doing this, talking about it a long time ago. A person who doesn't have good occlusion doesn't sleep well because he could be having something, an obstruction from his occlusion. Young kids, we are diagnosing them with attention disorders, but is it the sleep that is not causing them? Because the 1 hour equivalent loss of sleep reduces 2 years of cognitive maturation and development. That is, a 6th grader will perform like a 4th grader. And we have a lot of our kids who are like, they're not focusing, they're having issues, and we see them put in some medication so that they can focus. But is it true? That we need to look into. And sleep disorder is sleep apnea. Sleep apnea is, there are different kinds of apneas. One is central, that means your lung or the diaphragm is we cannot breathe well. Then you have the obstructive sleep apnea, which is some obstructions that causes problem for the lungs to breathe and the diaphragm to function normally. Then there's a mix. Now, obstructive sleep apnea is where the dentist comes into play, is they can see the obstructions. One of the obstructions very common for our kids is the tonsils. I used to be a big, not want to take out any organs if not necessary. If your gallbladder is not functioning, you don't need to take out your gallbladders. There's a reason. The same thing with, would not recommend taking out tonsils. But you see some of the tonsils, like the number 4, where this kid will not be able to breathe when he sleeps. Because when you sleep, I'm just going to show you the slide. With this slide right here, when you sleep, the tonsils close in your pharyngeal space. That is, when you breathe, the air needs to go through this blue path. And when it comes down in the tonsils, your tongue, if they're obstructing, your kid is not breathing, you're not breathing. And so that's an issue. Most of the issues that we have is the tonsils. And that's where your mouth comes into big play to see if you have any of these issues. So obstructive sleep apnea can cause depression, loss of memory. It can cause snoring. You can have fibromyalgia. You can have death is for anything, and hypertension. So when you don't sleep well, you don't have good oxygen, you're not focusing. When you're not sleeping well, you have certain enzymes that are released which are very high, which can be affecting, causing you depression, fibromyalgia, which are interrelated, and hypertension too. And this is the last part of my slide where I really want to end with, is like this: if one were to pass a law limiting holistic physician to a single holistic method, I would stick to my dentist. Dentist is an important part where most of it is just a tooth pain. I'm going to be fine. Let me just take out my tooth. I'll be fine. I'll deal with it. But if you're not functioning health with your mouth, the whole mouth, you're not going to be functioning systemically too. And this was what actually a physician from Switzerland who wrote it, and I really think that is a very important thing to see. So the last part, I left a lot of part for the questions because I thought people like to ask more of their something from themselves. So if you have any questions, you're welcome to ask. Surprised nobody has any questions. Okay.
I had what I thought was the mercury silver taken out. My dentist put in white
Filling?
White filling. Does that have mercury?
No. The white fillings are two kinds. There could be a ceramic or it could be composite. The composite is the one which is soft, is done directly in your mouth. With the soft filling, there is also the concerns which arises a BPA in it. That is a bisphenol. We probably remember about 3 or 4 years ago, Canada passed a law that no baby bottles should have BPA in it. And that's another concern. So we are shifting more and more into ceramic restorations because you don't have the concerns about the BPA. There are restorations that are completely free of BPA, that is a bisphenol, but they don't last long. It also depends on the composite, which kind of composite. If you don't do it right, the technique, you can actually release BPA. It takes a lot of high temperature if it's not set completely. It's just like you have to cure it completely. It's baked well, then you don't release the BPA. The plastic bottles that you drink off and you leave it in a hot sun day in your car, the water is full with BPA, and which is the ones that line your cans, so you don't want it. So that's a concern we don't have with canned food. So the BPA is another concern with the direct composite material. Okay, I saw you first. Go ahead.
When you talked about foods breaking down teeth, what about the fact that there's a dynamics with remineralization versus demineralization?
Of the teeth?
Yes.
Yes, teeth can remineralize. When you have teeth, the teeth is kind of labeled into 3 layers. Your first layer is a white part. That is what you see when you smile. The second part is the yellow part, which is sensitive. When you eat something sweet, that's sensitive. It's a yellow layer you start to see when you brush really hard. And the third layer is your nerve. That is where the root canal comes. Remineralization, especially when I mentioned about the ozone training, the ozone actually can remineralize. Ozone can stimulate stem cells. They are used like in treatment of cancer, so that's where this can remineralize. It can stimulate any form of stem cells. So it's when we do recommend ozonated olive oil, which we dispense to the patients, which we use them to ask them. You can use it as a toothpaste. It doesn't taste so great. It smells funny, but it can remineralize when it's in the first layer of the tooth, which is the enamel, which has calcium. Your second layer of your tooth, that is dentin, doesn't have calcium in it, so you cannot remineralize. So to a point, you can remineralize. That's incipient when we call it as a weak area. We say, okay, go ahead and we will use the ozone and we'll see back in a year's time how your teeth get stronger. But ozone also, to add, it helps you also in gum disease because ozone is antiviral, antifungal, antibacterial. It can kill anything, in good and bad. And at the same time, it can stimulate stem cells. So if you're having gum diseases, it can really help you kill all the bacteria, get your gums healthy. So you can actually put it around your gum area, floss it, and helps to strengthen your bone and your teeth. I have one. You had a question. Dry mouth is a very extensive subject by itself. One of the very common cause for dry mouth is your medication. So people who are on different medication, when you read your medication list, you will see the cause dry mouth. Antidepressants, as anti-sedative drugs, they are a very common cause of dry mouth. Then you have systemic relation too. You can be people who have like autoimmune disorders can have dry mouth too. But the very common one is medication.
I heard that hydrogenate peroxide diluted 50% is preferable to using toothpaste. Will you comment on that?
It was used to be the one which was used to be very used, recommended by the periodontist or the gum specialist. It works good. It works even if people use hydrogen peroxide mixed with baking soda to whiten their teeth. It will kill the bacteria, so it will act as your antibacterial for you. Dr. Waters?
Just clarification on the enamel. Are you saying that the enamel organ stem cells are within reach of local ozone?
Mm-hmm.
Wow. Is that published stuff?
Yes, especially you have been trained too with the Dr. Phil Malika. We have an article for him, yes.
So it's at the ozone meeting
Yeah.
probably every year?
Yeah.
Great.
Mhm.
Thank you.
You can go ahead.
If you were to take out that mercury filling, what does your office replace it with?
The material you replace with white fillings, that is a composite and ceramic. And just like I said before, we are going away from composite fillings to ceramic because ceramic lasts longer than composite. Everybody says, you know what, mercury has a longer lifespan. Yes, it does have a lifespan, but when you go back to that tooth that I showed you, it shows how much destruction has been done to this tooth. If you look around here, you see all that breakdown around the tooth and the filling. So you have a lot of destruction. But the ceramic restoration, when you consider with mercury filling, mercury is a metal. So metal expands more than ceramic. So that's why you have that gap between your teeth and your silver filling, which is the main cause of the bacteria to go down. And that's when you end up having root canals too. So we prefer to use ceramic more and more, but we just still, depending on the size of the filling, we use ceramic and resin fillings, which is a composite.
Do you have any comments on the use of probiotics intraorally?
Yes, I do recommend one from, that's one which my kids use. It's called from True Botanica. That is called the Throat Defense. Now it should be called True Defense. That's a intraoral probiotic that I recommend. It's it's used to call True Defense. It's called Botanica, True Botanica. Throat Defense, yeah. Go ahead. I'll just take her question first. Go ahead.
Just earlier this month, I found out that I had a cracked filling. Does that end up leaking mercury into your mouth?
There is actually on a tooth, a gassing tooth. If you go look up online, Google it, is a YouTube video as a tooth is just extracted, which releases mercury vapor even after extraction. So even if it is cracked or is still half, it will still continue to release mercury vapors.
Yeah, because I found out that the one in my tooth was hurting and had a cracked filling, which developed a huge cavity that they tried to fix and ended up pulling my tooth. So I wondered about that. Now, you're hearing that.
Go ahead. You had a question? Oh, you, sorry.
With having root canals, whenever they fill it, I know they fill it like the
Mm-hmm.
system, the heavy metals,
When you poisoning, the gold, if it depends on what is used to strengthen the gold. If it is a 22% gold, it's going to be really soft and it's not going to have been used in your mouth. But what is used in combination to strengthen it? Is it a chrome, cobalt, or platinum? So that's what's important. And the whole thing about root canal is, I don't have any root canals in my mouth, but if I may not handle a root canal as well as you do. So each one is different because it is blocking a lymphatic system. It's one of our lymphatic drainage that has been created for us. So when you imagine a tree with a trunk, which is the center of your tooth, which is where the nerves are, and that is where it's cleaned up and plugged. But the lateral branches that you have is not cleaned up. So that's where the bacteria can stay. They can release toxins, and that's where the toxins are the problem. It's just like any other disease that you can get from any bacteria or from any virus. And more we see, okay, the bacteria are the ones that cause the root canal or the infection, but there are still virus can be the too. We have in our normal flora, we do have virus in our mouth too. So it's the toxins, which you call as endotoxins, that are released from these microorganisms, which are responsible for some of the health relations that we associate to. Yeah.
So if you're
We are like, there are holistic dentists who would completely recommend getting your root canals out of your mouth. But that handicaps you. So you're like, if you end up having, if you have 4 or 5 root canals and missing 4 or 5 teeth, that is going to mess up your occlusion. You're going to bite. So we use actually a lot of ozone therapy to clean up before you do your root canals. So we inject root canals into ozone into your canal. So just like I said, the tree, imagine the trunk. So we inject the ozone. The ozone is a gas which can diffuse to different areas like the branches, and it can clean up and kill all the bacteria. And like it really can even there are shown growth of bone back and healing. And that's when after that we fill it with a material which is biocompatible. Thank you. Oh, good, sorry.
What are your thoughts on fluoride?
We don't use fluoride, so I don't like it. So, but if fluoride is the one that it is in the water, if they use fluoridated water. I always ask the patients, if we had fluoridated water, we've been using fluoridated water for so long, so none of us should ever get cavities. That means none of our grandkids should ever have cavities. So where is it going? The fluoride, when you drink anything, the first area that you absorb is down in your system. So it gets deposited in your bone and other wrong areas that we don't want it to. So by the time it's actually absorbed to your teeth, it's not there. Systemic fluoride, like topical fluoride, I'm okay with. I personally don't use it. Good? Okay. Thank you very much for your time.